for the ventricle, the atria. This is your right atria right here, and you have two vessels that empty, or three vessels that empty in. The superior vena cava, the inferior vena cava. And in the pig, they come kind of at this right angle, but in people, they come straight up and down, if you look at your model. And then do you remember the third vessel that empties in here? Superior vena cava, inferior vena cava, and the coronary sinus. And this is your coronary sinus right here. Do you see that? This drains the heart from drains the blood from the heart muscle itself. This drains blood from the head and neck and arms. This one from the trunk and the feet, and this from the heart itself. So all three of those empty into the right atrium. You see, this is like the overflow valve right here, so we have extra blood in there. It goes through the this is awesome. This is the tricuspid valve. Can you see that? One, two, three. We have an excellent tricuspid valve intact over here if you'd like to look at it. Three flaps, see right there, 1, 2, 3. And they are all anchored by the chordae tendineae, the little strings, into the papillary muscle. And the papillary muscle are part of the trabeculae carneae, which are these like meaty ridges right here. So then blood goes from the atrium into the right ventricle, so through the flap into the right ventricle, then out from the right ventricle to the lungs via the pulmonary trunk. So if you look up in here, your cusps are not well preserved, but you can kind of see them right there. So blood would come out through here, go to the lungs, and then return to the left atria via the right and left pulmonary veins, right? Veins bring them back. So here's your 1, 2. They go into left atria. This is your bicuspid valve, your mitral valve right here. You see really nice chordae tendineae, papillary muscles, trabeculae carneae. Did you have a moderator band? I do not see a moderator band. Then it will go out through here into the aorta. So punch that over there. Look, it is connected, and you have 3 branches. Now this one was removed during the slaughter or whatever, but you have brachiocephalic, left common carotid, left subclavian, and then the rest of this will turn and be the abdominal aorta. All right.